This is your Filipino radio experience in Las Vegas. PHLV Radio. PHLV Radio. The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Marife Aczon-Armstrong.
Aloha! Magandang gabi po sa inyong lahat. Good evening. Naimbag asardam. Maayo magabi. I'm trying to speak in different languages and different dialect in Filipino. So welcome to Healthy Mondays with the AAPINA of Nevada. And I'm yours truly, Dr. Marife Aczon-Armstrong, founding president of the Asian American Pacific Islander Nurses Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. And here we are again in this Monday night. Thank you for tuning in. Maybe you are here in Las Vegas, Nevada, maybe in Henderson, maybe in California, maybe in what else you could be in? California, New York City, Canada, or even in Greece, Italy, Africa, and all over the world. Thank you for listening to Healthy Mondays with AAPINA of Nevada. Wow, it is cooling down here in Las Vegas, Nevada. I just came back from Honolulu, Hawaii for a vacation for 17 days. And I really don't want to come back with the 3 digits. And the week that I came back on a Thursday, it was 120 degrees Fahrenheit. So it was a world record, I guess, or a record for Nevada to have 120 degrees. So yesterday, it started raining a lot. It cooled down, and this morning when I woke up, it was in the 70s. So thank goodness for the rain. But now it's picking up. It's now in the 90 degrees again. And having said that, are you worried about your eyes with this weather, with this hot weather? So I invited a special guest, a colleague of mine, and he is not new to Healthy Mondays, Dr. Surajit Dey. Welcome to Healthy Mondays, Surajit.
Thank you. Thank you, Marife. Thank you all, and I really appreciate you having me here to talk about in the Healthy Mondays. Thank you to PHLV Radio for hosting me and hosting us this evening.
Yes. Surajit, would you like to share with our listeners out there your background?
Yes, absolutely. I was actually, before I do that, I was listening to your comments on coming from Hawaii after a 17-day holiday break, hopefully. Yes, it is very hot here, and I had gone through this heat a couple of weeks back. It was very, very warm and hot. I myself am leaving for a little bit cooler Seattle next week.
Oh.
And Portland, so hopefully we'll get some rain and some nice cooler weather. But to the speakers, my name is Dr. Surajit Dey, and I am a professor at the College of Pharmacy at Roseman University. I've been with Roseman University for the last 15, 16 years. And my background is mostly in drug delivery and drug delivery to the eye. So I'm a scientist who works with the ocular, the eye route, and we work with different types of disease states. And some of this, what we will be talking about today, about different parts, different components, and things about that. So I'm really excited to share that information with you all, and thank you for inviting me again.
I'm happy to have you back because I know you can share with our listeners out there how to take care of their vision. And it's interesting. I'm going to be traveling too, and I wanted to share to our listeners out there that I will be going to the White House to
wonderful.
the 4th of July celebration. I was nominated as I guess what they call super COVID-19 volunteer. And thank you, Asian Community Development Council, for thinking of me when they asked for another volunteer to go with them to celebrate the 4th of July in the White House. So I will be in the
how
DC
exciting
area.
is that? That is
Yes.
wonderful. Congratulations.
Yes, that is exciting. And I know I'm looking at the weather, waiting for my logistics. So stay tuned because I'm going to be broadcasting July 5th, I'll be broadcasting. Hopefully, it will go through on the Mall of, what is that place
of
there?
the Americas. I think.
Wall of Americas, yes. So stay tuned for that. But in the meantime, thank you, Surajit, for coming tonight. So the first question is, how can heat affect our vision?
So that's a great question, and all of us who live in the west, southwest area, we are not new to heat. Often, Las Vegas, where we are from, goes beyond 115 degrees many times, and I hear Phoenix is even hotter sometimes. So we are living in a climate which is not only hot, but it's also dry, right? So the humidity is often in the single digits. So how can heat affect your eyes? Heat can affect your eyes by drawing out that moisture, a layer of moisture that is constantly present on top of your eyes. That moisture doesn't only hydrate, but it also provides very important protection from different types of microorganisms, dust, things like that. We humans normally blink about 30 times a minute. You don't even know, by the time you're listening to me, you probably have blinked 10 times. And every time we are blinking, we are putting in a fresh layer of that liquid, which we all know as tear, and that tear film is constantly on top of your eyes. So the tear film is actually very important. It contains a lot of important substances. It contains a lot of antibodies. It contains different types of chemicals to protect your eye. But one of the primary goals of the tear film is hydration. So it provides hydration, corneal hydration to the eye. Now, when the temperature is hot, it evaporates that film faster and faster. So often you'll see that in the summertime, your eyes feel a little bit dry, a little bit chapped. And that dryness that we have is basically, if it goes too much, we can experience some certain symptoms, and we call them as dry eye symptoms or dry eye disease symptoms. Chronic dry eyes is actually a clinical disease that happens where there is not enough tear production. But heat can also take an extra part in that and make things work. So I would suggest to all our viewers here that in the summer, protect your eyes. Make sure that you wash your eyes, and sometimes also when you're out in the sun, come inside, come to a cooler area so that your eyes can regenerate that tear fluid. In addition, there's a lot of over-the-counter lubricants that are also there. So you can put, if your eyes are feeling a little bit dry and chapped, you can always put those lubricants over-the-counter eye drops. If all of those things do not work, I would also strongly recommend to go and see a doctor, because you can be suffering from something called as chronic dry eyes. But heat definitely makes things worse. So
I remember my son was having problem with dry eyes when we were in Hawaii, and we had to go and look for a drugstore where they have the eye drops.
Eye drops, yeah.
Yes. So I'm trying to figure out which eye drop to get him. There's one that has medication in it, right? So I guess we need to educate our listeners out there. Don't just grab any eye drops there, because sometimes there's something else in the eye drops. So I guess for the ones that has medication, you have to have a prescription for it.
That is correct.
They wouldn't put it on the out of the counter.
Yeah, and I would say that if you always thought that you got dry eyes, you got that symptoms, and the symptoms are very straightforward. It feels like it's dry, it's itchy, it's red sometimes. It feels like something is uncomfortable. If you see those symptoms and it doesn't go away with giving some eye drops from over the counter. The eye drops do not have any drugs per se. It's mostly some lubricants and something to make it comfortable, so that film that is on top of your eyes is constantly rejuvenated. But if it doesn't work, then I would suggest going to a doctor and trying some prescription eye drops.
So remember, what I pick up so far from Surajit is blink, 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 blink. And I guess the blinking is actually involuntary.
Absolutely.
Right?
The blinking is involuntary. You don't realize when you blink, but we blink about 30 times a minute. So every single time we are blinking, we are putting a fresh coat of that tear fluid. Your tear is the best and probably the only one that is coming out from your body to protect your eyes.
So we have a little tear duct. So if you look at your eye like this, there's a tear duct that's where the hydration is coming from.
Yeah, actually, tear glands are present all around your eyes. So there are tear glands present on the top, on the bottom, and obviously, if somebody is emotional or crying, you can always feel that tear even going to your throat as well. So it comes out of there and goes through the nose and goes to the throat.
I remember when I had, I guess my last eye exam, my eye doctor said that there's some oil, the oil forming in my tear duct right there. And she said that sometimes I should press it so then it would just come out.
Yeah.
Is that I forgot what she referred to, the sebum or sebum?
Sebum.
Yeah, the sebum. So that would be the oil too.
Yeah. And I wanted to also let the listeners know, again, without going too much technical into it, let you all know that, your eye, your tear, it's not only water. I mean, obviously, it's salty because it's got some electrolytes and salts, but it's not only water. Your tear has really, other than water, two additional components. One is the oil that you're talking about. The oil is automatically there on top of water. So there is an internal prevention mechanism of evaporation already there. So it prevents evaporation. That's why the oil comes out. There's also a little slimy mucus layer so that it actually sticks to your eye, because obviously we are standing up, right? And if there's liquid, it tends to go down due to gravity. So because it can stick, there is a little bit of that sticky mucus layer also in that gets secreted. So three things really secrete. One is the oil, and one secretes the oil, one secretes the sticky mucus, and the other secretes the water-based tear thing. So it's a lot of complicated things that are going on, and all is there to protect your eyes. So please take care of it.
Yeah, we have a wonderful body. Our body parts, they all have functions. And so tonight, if you're just joining us, we are focusing on our eyes. With this weather, Dr. Surajit Dey is going to help us understand what can we do to protect our eyes. So there is another question I have here, Surajit. Are your eyes sensitive to light? And that's the question to you. And then what does it mean, Surajit, when your eyes are sensitive to light?
Sure. Our eyes can become sensitive at any age. Often we see sensitivity because of multiple reasons, and one could be disease, one could be conditions, environmental conditions. If you think your eyes are sensitive to light, which means you can't tolerate very high light situation, I would always try to get some sort of a protecting eyeglass. Now, often light sensitivity is due to amount of light that is coming inside the eye and how the light is in the retina, how it's forming in the back of the eye. Often you will see that light sensitivity increases because of some disease states, or sometimes because of age and other factors as well. So I would let the listeners know if there is eye sensitivity, then please, first of all, go to a doctor and see how they can reduce that or not. Sometimes you get sensitivity by looking at your laptop or by looking at your computer. In today's world, we do that work all the time, right? All of us are connected to some sort of a screen for probably for some people, maybe 24 hours, but for a lot of us, 12 to 16 hours a day. So that glare that comes from this blue light and all that stuff can also increase sensitivity. So having a protecting film, wearing glasses that reflect out that light thing would help in that sensitivity.
I'm glad you mentioned age, because I am getting there. And I like to share with our listeners my personal experiences with the topic that we're covering. And I too have, it's more at nighttime. When I see the post lights, they're just like fire and glaring. So and I'm so scared to drive at night because of that. So I went to see the doctor, and they said, you have early signs of cataract. but it's not ripe yet. So when they say ripe, can you expand more? Because I'm sure when you go see a doctor and they say it's not ripe yet, we don't have to do surgery right now. So Surajit is going to tell us, what does it mean when they say it's not ripe yet?
Absolutely, absolutely. And that nighttime glare, nighttime firing thing that you're talking about, it's common. It's not uncommon. And as we age, we are born with our eyes and the structures inside the eye. Inside your eye, you do have a lens, which essentially, if you look like it looks like a transparent jelly-like substance. And over time, as we age, that lens slowly changes because they are made of proteins, and proteins denature. To give you a very simple example, all of us like eggs or eat eggs, right? So the white part of that egg, that's like that transparent. When you open an egg, the white part of the egg is transparent. But you heat it up, it becomes white in color. So it's the same thing is happening inside your eye, that over time and over a variety of reasons, slowly that lens becomes blurry, means it gets slowly, this white particle starts to come in. So when the doctor told you it's not ripe yet, means it's too early. It's showing signs, but it's early enough not to do any surgery.
So it's not covering yet the retina, because when I look at my eye, my son said, "Mom, you had some kind of light blue." So I think like on top, when you look at it, it's just like a kind of like a shade of blue. So that's probably what the...
Yeah, and it will, Marife, that's an important point, distinction, that your lens is actually hanging there. It's hanging, and there are like fine threads that are connecting it to the other surfaces. So it's basically right there in the center, dangling, if you want to call it. So it will never form on top of the retina, but the lens will become slowly cloudy and cloudy. And you can see that in your pets as well. Dogs get cataracts as well. So if you see an older dog, the chance and likelihood, if you see through his or her eyes, you'll see they have cloudy eyes. That means they're getting that early signs of the cataract. Now, a cataract surgery is an outpatient surgery, very, very, very common. I can tell you this. My grandmother, who's 96-year-old, got her cataract done when she was 89. So it's a very common surgery, and whenever the physician thinks it's right, I would say go ahead and get it done. You'll see a stark difference between that. Now, obviously, since we are born with these lenses in our eyes, we can't replace them. You can't just put someone else's lens in there. So what they would do is they would put something called as an intraocular lens, which is like a plastic lens, and they would slowly put it in that place. So you'd lose your birth lens, but they will put a plastic lens that is going to stay there.
Replace it.
They replace it with a plastic.
I've watched an operation before. It's amazing.
Yeah.
It's like, wow. All these things, all the advanced technology that we have.
Exactly.
It's really amazing.
Fascinating. Yeah.
Okay, so I'm trying to look at what other questions I have for you, Sergey.
Yeah.
Here, I found this vision syndrome. Is that the same one as you're talking about, the dry eyes, or is it different? What is vision syndrome in the summer?
So vision syndrome is a collection of signs and symptoms that can happen because of anything, effectively. So heat is one of the causing agents. So in the summer, as you said, vision syndrome really means blurry eyes, inability to, when it's too bright outside, to adapt to that brightness. It could lead to that dry eyes I was talking about, less tear production. It could lead to itchy eyes, red eyes. So all of those are part of this vision syndrome. It's a very generic and general term. So I would say that in the heat, vision syndrome really means all of the things that we discussed. And I also want to bring in one thing, and I think maybe we'll talk about it soon, is before the summer hits, we have spring. And after the summer, we have autumn, right? So we have a lot of flowers blooming, a lot of fresh cut grass, a lot of this thing. So allergies are a huge part of this. So your runny eyes, your red eyes that are dropping, your nose is running, all of these are because of allergies at that time. So you might find itchy eyes and red eyes during allergic times as well. Very easy thing to do is to take anti-allergy medication. There are plenty of them over the counter. So we all know Zyrtec and Claritin and Allegra and all of those things, and Benadryl All of these are there to prevent those allergies and hopefully your eye allergies as well. But if your eye allergies are particularly bothering you, there are over-the-counter eye allergy medication which have drugs in there too. There is one called Pata Day, which is once a day. It used to be prescription only, but now it's available over the counter. That is particularly made and formulated for eye allergies.
That's great to know. See, our listeners out there, there's a lot of information. Even I myself are learning a lot of things from Sergey. So we would be, what is that word that I wanted to say? We are in the midst still with COVID-19 global pandemic. And I know here in Nevada, we are now able to go around without our mask. We are herd immune already, immune community. In Hawaii, when I was there, we still have to wear our mask. Because we're talking about our eyes, the other, I guess, last question I have for Sergey is how to disinfect our glasses to help prevent COVID-19, because COVID-19 is more contact, right?
Right.
So how do we disinfect our glasses to help prevent COVID-19?
That's a great question, and I'm glad that you brought it up. Obviously, we are in the midst of a pandemic that has been going around for the last 16, 17 months. It feels like forever. And hopefully we are on the tail end of it. At least it feels like it. Things are coming back to normal. There is some normalcy out here. As I was talking to our listeners here, as I told you that I'll be in Seattle, I think state of Washington still requires masks.
Oh, okay.
So here they are not, but if you're fully vaccinated. So first and foremost, I would say if you haven't, go get your vaccine and follow all the protocols that are given by your health officials and CDC and all, hand washing, social distancing, and all of that. All of them are useful. We need everyone's help to combat this global pandemic and global emergency.
Yes. And I echo that. Please, if you haven't gotten your vaccination, please get vaccinated. It is to protect yourself and your loved ones. And it really going to help us to get back to our normal. The longer that you delay it, the longer it will stay where we are. So I also share that with our listeners in Hawaii. I had heard some people are still, I think even here, there's some people who are still skeptical about it. And we have some initiatives there to increase vaccine confidence. We have a lot of community outreach, different with ethnic minority. Really interesting that statistics shows that our ethnic minority population are the ones who are resistant or does not have confidence with the vaccine that we're giving for COVID. So
yeah, and you're not alone. Remember that 150 million Americans have been vaccinated so far. So there's a lot of us who have been vaccinated. Marife and I, and we have been both vaccinated for about 4 or 5 months now, I would imagine.
Yes.
It's early in January. But to go back to your question on on the eyes and how to disinfect, I would suggest that if you're wearing glasses, always to use a proper, appropriate glass cleaner. It's not always necessary to use Lysol and things like that. There are plenty of antibacterial cleaner. Even the glass spray that you have has some amount of alcohol in it that can clean your glasses. Whenever I normally wear contact lenses, as you can see, but whenever I go in outside spaces and in crowded places, I tend to wear a glass. And the reason I would tend to wear a glass is because that's another barrier for the virus to enter.
Good point. Yes.
I would also say that the pathway of eyes is actually a minimal pathway. It mostly goes from your hands or other touch points to your nose and mouth. The eyes are there, but it is a smaller pathway for the virus to enter. But to prevent that, wear a pair of glasses. When you go outside, I would also say in this heat, please do wear sunglasses. Please do wear UV protection sunglasses, and we'll talk more about that at another time. Yes. But wear glasses, and anytime you go home or go from a crowded area, you could always wipe it down with an appropriate wipe cleaner. and that way it's all wiped down. So you don't have to worry about it.
Yeah, thank you, Sergey. So, as we're going to bring you back in July because July is the Ultraviolet Safety Awareness Month.
Absolutely. We're delighted to be here.
That's when we're going to get our sunglasses,
Yes.
right? So, Sergey, thank you so much for all the information that you have provided. So, simple explanation really helps our listeners out there to take care of themselves. I would like to ask you to give our listeners any words of wisdom for them before we say goodbye.
All right. So thank you for spending the time with us. And some parting thoughts would be, and some pearls would be, make sure that you have your eyes checked every year or as soon as prescribed by your ophthalmologist or optometrist. So go and get your eyes checked. Often we forget in our busy life not to get our eyes checked. Do get it checked every year. Wear appropriate sunglasses or eyeglasses to protect your eyes. And in this heat, take care of yourself. Be hydrated. Drink plenty of water. And if your eyes feel a little bit dry and chappy, go and get a topical lubricant, or if that doesn't help, go and see your doctor.
Thank you, Sergey. Remember, you only have one pair of eyes. Take good care of them. So I wanted to look at anything else that we wanted to cover, but I think we covered everything. And what I get is blink, blink, blink.
Absolutely.
Yes.
And great spending time with you. And thank you for PHLV Radio for hosting me. And I look forward to talking to you again at a future time.
Next month. And thank you, Sergey, and thank you, PHLV Radio, for your partnership. I am excited. We're going to broadcast. I'm going to make it happen, and we're going to make it happen. We're going to broadcast from DC. And anything else? I feel like I'm forgetting something. But anyway, continue in July with Sergey. I'm going to bring him back to tell us more about how to protect our eyes. In the meantime, remember, every Monday is a healthy Monday. Aloha.
Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.
This is your Filipino radio experience in Las Vegas. PHLV Radio.